Hi there, my name is Ewane Edmond Elime. I'm a nurse by profession, and today I shall be discussing nosocomial infections, which are also known as hospital-related infections or hospital-acquired infections or healthcare-related infections. Okay, these are infections that are contracted by a patient while they are admitted in the healthcare facility or in the hospital. Okay, and it must be considered a nosocomial infection after a patient must have stayed in the hospital at least for 48 hours, which therefore means that if you admit a patient now and a few hours later, you begin to discover some things, we cannot actually consider that as nosocomial infections according to the definition of nosocomial infection. So it must be at least 48 hours after admission of that patient. Okay, so there are a good number of things that are related to or that can cause nosocomial infections. Okay, we are looking at things like the prolonged use of antibiotics, especially broad spectrum antibiotics. Okay, broad spectrum antibiotics are antibiotics that can act on both gram-negative and gram-positive bacteria, or in simple terms, antibiotics that can act on a wide range causing disease bacteria. Okay, a bacteria that can cause a lot of diseases. Any antibiotics that act on such a bacteria is called a broad spectrum antibiotics. So I don't want to start listing the examples of antibiotics that are broad spectrum. That's not our focus today. Our focus is nosocomial infection. Okay, and we're trying to look at how we can curb the existence of these infections. Okay, we don't want a situation where somebody comes to the hospital seeking for help and getting another one while trying to get help, in a hospital. Okay, and unfortunately, nosocomial infections always come from the side of the healthcare professionals. Yes, okay, from the side of the healthcare professionals. Okay, I already gave some examples how people can contract infections while they stay in the hospital. Okay, we also look at other situations like surgical procedures. Generally, when healthcare professionals carry out invasive procedures with invasive devices like catheterization. Okay, using a catheter in many ways can cause nosocomial infections. It is not that procedure itself, but the way the procedure is carried out, and that is the problem. Okay, sometimes some healthcare professionals want to do a catheterization and they do not respect the aseptic technique that should be respected before that procedure is carried out. Okay, it is very risky for a healthcare professional to be carrying out such a procedure without strictly maintaining aseptic techniques. Very, very risky. So we healthcare professionals must be very keen on this aspect, as WHO is also paying very huge attention on nosocomial infections. Okay, like I rightly said, we don't want a situation where somebody comes to the hospital seeking help, and then we give them other conditions which are really not theirs. Okay, like for example, if you leave one patient and after having carried out a procedure and you do not wash your hands strictly as hand hygiene is supposed to be done, and then you get to another patient, there is a tendency that you will carry an infection which is another patient's to another patient. Okay, so we must be very, very careful and to ensure that people don't suffer innocently. Okay, so I would like to remind us, the healthcare professionals, the 5 moments that we should or we must carry out hand hygiene It is very, very important. This is a number one standard infection control procedure. Hand hygiene is number one standard infection control procedure. If we neglect this, patients will suffer from nothing in our hands. Okay, number one, when should we do hand hygiene? The first one is before touching a patient. It's very, very important. Second one is before a clean procedure or before an aseptic procedure. You must wash your hands. The third one is after body fluid exposure risks. Okay, after having come in contact with the patient's body fluid like blood, urine, and so on, etc. So you must wash your hands after that. And the fourth one is after touching a patient. Okay, after touching a patient, it's a must that you do hand hygiene. And after touching patient's surroundings, we usually say after touching a patient's surrounding, like leaving the patient's room after having touched all of those things. And before you leave the room or the patient's surrounding, you must do hand hygiene again. Ladies and gentlemen, my dear colleagues, if we consider all of this, factors, and we will see that nosocomial infections will not have a place in the hospital. And even if they should, or they have, it should be very little. Okay, this is what I wanted to talk about today, and I hope the message is passed and we will have a better care for our patients. Ewane Edmond, Elime. Ciao.